Hi everyone, this is Mike from NewJerseyInsurancePlans.com. Today I'm going to do a review of the Horizon Blue Cross Blue Shield Advantage EPO Bronze 150 plan. This is a plan that is sold on the individual market. It's in the marketplace on the exchange, and it's also available direct through Horizon Blue Cross. Either you go to them directly or you go through a broker like myself. And I wanted to do a review on this plan today because it's one of their cheapest plans that they're selling. And it's also the plan that a lot of you were moved to if you had the old EPO or EPO Plus plans that they used to sell. Also their old HMO coinsurance plan. This is the plan that they're automatically putting everyone in unless you choose a different plan. So I thought it would be a good idea to go over this plan today. To start it off, I brought up their full page summary sheet, which is quite a few pages of the details of the plan. So I will go over some of the highlights of the plan so you can see how it will work. Now the Advantage Bronze plan does not require referrals, so that is a benefit, and it uses their full network, their managed care network, so that's a good selling point for that. If you are covered as an individual, there is a $2,500 deductible, and I will get into when that applies and how it works. And if you're a family, it's a $5,000 deductible. Now that's applied per person, so if you are a true family, if it's two adults and a few children, each person would have their own $2,500 deductible. So if dad goes to the hospital and has a claim for $20,000, he will pay his $2,500, and then he will pay whatever it is after that, for the plan. In this case, it's probably 50%. So that's how that works. Now there's also a maximum out-of-pocket for the plan. For any one person, it's $6,350, or for a whole entire family, it's $12,700. And what this is the total amount of money that you could possibly pay per calendar year, not per plan year. So every January through December, it's a total of all of your claims, any deductibles and coinsurance, pretty much anything the plan approves and you pay for, excluding your premium, will go towards that amount. So once you pay $6,350 as a single, you are done paying for the year. You will not have to pay another penny for your claims. Now, it uses a network of doctors. I will get into that later. Do not need to see a primary care physician for a referral. Now going down here, your primary care visits. If you decide to see your primary care physician first, you will pay a $30 copayment, and that's assuming you choose a primary care doctor. So if you choose Dr. Smith in your local town and he is your doctor that you pick, you pay $30. If you self-refer to another primary care doctor, it goes towards your deductible, just like any specialist visit would. So in that case, any specialist or another primary care they don't choose, you're going to pay your deductible, which is $2,500, and then you will pay 50%. And the amount that you pay, it's based on the agreed upon rates in the contract. So if your physician has a contracted rate of $120 per visit with Horizon, that's what you'll pay, $120 per visit. Further breaks it down to other practitioner office visits. So short-term therapy, which would include chiropractic care, you will pay $30 copay for those. Preventive care, screenings, immunizations, they are covered at no charge. Now, keep in mind, if you do go to your doctor for preventive care, but also bring something else up, say you have a freckle you want them to look at, and that visit now is no longer a preventive care screening, it's now a diagnostic visit, so it will be charged as such. So keep that in mind when you go to the doctor, that sometimes what you think is preventive care may end up being going towards your deductible. Now, any type of testing done, I would assume almost everything on the plan, other than your primary care visit, is going to go towards your deductible, and then 50%. They do break it down that in some cases you'll have a copay if it's done in an office, but a lot of these things are rarely, if ever, done in an office setting. So I would just assume you're going to pay the $2,500 up front, and then you'll pay your 50%. So best case scenario is you'll pay $30 in some cases if these things are done in an office, like an MRI, but I would anticipate it going towards your deductible. So MRIs, gosh, some of them are $1,000, so I would expect that to be the charge. And this also includes your prescriptions. So if you take generic, preferred, or non-preferred drugs, they are covered at 50%. after your deductible. Now the amount that you pay for your prescriptions, they do accumulate towards your maximum out of pocket, so that's good news. So if you take some very expensive drugs and you have a large out of pocket every month, that will go towards your maximum for the calendar year. And it's not noted here, but the pharmacy manager now is Prime Therapeutics, which is a Blue Cross owned company. I think there's 10 or so Blue Cross companies that own and operate Prime Therapeutics, and it used to be Caremark, but now it's Prime. Now this keeps breaking down, and I'll make this summary sheet available to you online, so if you want to look through it, but I'm just highlighting the major things. The next one down would be emergency room services or urgent care. Again, just like the other things, expect it to go towards your deductible, but if you have urgent care and they're listed as a primary care physician, which would be really rare, in that case you'd pay $30. Anything else should pay 50% after your deductible. Okay, so I'll continue down the line even a little more. Let's get into the mental health, behavioral issues, things like that. Scroll through this. Home health care, 50% co-insurance after deductible. Now this is something new, eye exam. This was part of the Affordable Care Act. Children under age 19 can now get an eye exam up to every 12 months, covered 100% by the plan. And they can also get glasses, believe it or not, every calendar year. The dental is not included in the medical plan, but they do tack on a pediatric dental plan, which is around I believe it's around $25 or $27 per month per child under age 19. So if you're getting covered with a few kids, keep in mind they're going to auto-enroll your children on this pediatric dental plan, which will be an additional $25 or so per child. And I'll go over that pediatric dental plan in a later review. There are some things that the plan does not cover, and this is pretty standard on any of the individual health plans sold in New Jersey. They're all more or less cookie cutter in what they will cover and will not cover. But these are some of the things that you would expect them not to cover. Now, getting into the network, if you need to look up your physicians to make sure they take your plan, you'll go to horizonblue.com, which I have already done. And at the top here, you will click Find a Provider. And in Plans Accepted, you are going to select Advantage EPO. And that is a network that this Bronze plan uses, and also their Silver Advantage EPO uses the same network. So if you live in, gosh, I don't know, Mays Landing, New Jersey, 08330, oops. You can type that zip code in, you can look up anyone you may want, say it's an allergy doctor, hit search, and you have to put a name in. So I'll do it within 25 miles, we'll say, is there Dr. Smith? I don't know. No, of course not. So that's all I have for today.